Hello, YouTubers. Joe Kersey here. Oh man, I thought I got all this stuff out of my eye. Joe Kersey here on Thursday, May 15th, 2014, at a hair after 1500 in the afternoon Eastern Daylight Time. Now, however highly improbable it seems or sounds, I've been casting about a bit to see what I might talk to y'all about today. I have a number of I make lists. I have a selection. At some point you're gonna hear, as Eddie says, right is left, left is right. You're going to hear about some of this stuff. And a brief digression. Well, yes, it will be brief. When I was the summer after my freshman year in college, I worked as a tour guide. Well, I worked in the parent orientation program at Ohio State. The student orientation and the parent orientation, because sometimes parents wanted to find out what they're going to be dropping their bucks on, bucks for the bucks. And the students stayed in Moral Tower, one of the twin towers of sin. And the parents stayed in Lincoln Tower, the second of the twin towers of sin there on the Olentangy River. And one of the things we did, we had group discussions and, campus tours, and you do the tours on foot, but a lot of times you do the tours on the bus. And of course, when you're speaking to a group facing you, left is right, right is left. On your left, on your right. And ever since then, ever since 1970, I have had intense trouble with right and left. And of course, in medicine, you sort of face the same problem because, as you look at a patient, their left is your right. Their right is your left. I may have done that backwards. Their left is your right, their right is your right. See? Well, anyway, you get it right on the chart, but you always have to, be sure about that. And it's particularly important in ophthalmology, where sometimes I would, at the request of the surgeon, or sometimes just because I knew the surgeon was I'd take a skin marker and I would write, like if the operation's going to be on the right eyeball, I would put an R in a circle over the right eyeball with an arrow pointing down. Or if it's on the left eyeball, a similar, an L in a circle. And it's particularly good, too, in some orthopedic procedures. In that case, maybe you'd write, operate on this leg. Now, obviously, if you've got some big gangrenous thing sticking out there that, like in a vascular surgery case, you're going to chop off, you don't have to write that. But I remember, I guess this is going to be a different story. I remember this one guy, he'd broken his hip. He was an older guy, that's sort of the category of guys that break their hips. And he'd fallen down, and he wasn't demented. Well, he's a bit demented, but not La La Land demented. And he had fallen and broken his hip. Now, essentially, pretty much anybody past the third year of medical school knows that when you see a guy lying on a cart, and so let's say, let's pretend my hands are my feet, okay? And if I don't have a broken hip, I can hold my hands straight up, i.e. my feet straight up. But if my hip's broken, one of them's flopped over the side. Guess which side has the broken hip? It's the one that has the foot flopped over to the side. So this poor guy comes down and he's going to have his hip nailed. It's a fairly straightforward. Depending on the type of fracture, you either put in a screw or a nail. You put in like a ball prosthesis, often more, or you do a nail, an actual nail, depending. And then, next day or two, and then get him up and walking around so he won't get blood clots and, toss him into his lungs and die. That's the whole thing about hip fracture surgery. So, we get him in there, and the guys come in, and they start to operate. They were getting ready to operate on the wrong side, and I said to them, I'm doing anesthesia. This is when I'm a resident. This is when the chairman of the orthopedic surgery department of Ohio State was just a notorious prick. Even more so than most chairmen are from time to time. He later went on to become editor of one of the major orthopedic journals. I congratulated him on his appointment as editor after that happened. And it was one of the most disdainful looks and statements ever made to me in my entire life. And I've been called a murderer, in the operating room. I've had a lot of people say a lot of stuff to me, but this guy, he's one of these Boston Brahmin guys. He'd gone to Harvard. And I said, well, congratulations, Dr. So-and-so. That's great. I said, I imagine you'll be glad to get back to Boston. It's like, who might even say such a statement to this guy? Well, anyway, so this man that we're operating on was actually this guy's, nominally this was this man's patient, this soon to be editor's patient, and I said to these guys, guys, look at the X-ray. That's the wrong side. And at this point, I sort of have a bit of an ethical dilemma. I thought, I know they're going to operate on the wrong side. Well, I do. Now, see, we weren't using one of these fracture frames. We just had the guy up on his lateral position. And so they get down in there and they find out there's no fracture. So then they close him up, and so we flip him over. And they do the correct side, finally. And then they actually didn't repair the fracture that time when they found the fracture. Now, from an anesthetic standpoint, this case was very interesting because, one, we had to change position in the middle of surgery, which is always kind of a pain in the ass when you're doing anesthesia. But second of all is this guy had been one of these really heavy smokers, and he had all sorts of absolutely tenacious sputum getting into his endotracheal tube, and I was not able to effectively suck that out of the endotracheal tube despite irrigation, despite all my tricks that Merle had taught me. I wasn't able to keep this tube clear. So I had to change this man's tube while he's on his side, which is under the drapes, which is always a bit of a challenge. I haven't had to do that but twice. And it's never fun when you have to, but sometimes it's other if you don't do that and you can't ventilate the guys, you're going to kill the guy, so you got to do something, don't you? That's just the way it is. So anyway, I asked these guys, I said, as they're closing this guy up at the end of the case, I said, now how are you going to square those two incisions? How are you going to square away those two incisions with the family? Meanwhile, editor to be had come, had bestirred himself from his office, up on the 9th floor. And actually made an appearance in the operating room. Well, he was probably one of the most non-committal individuals. He would have done one of these folks at a congressional hearing refusing to testify. He would have done one of those guys proud because this man basically was a total sphinx. Very impassive. He didn't, he basically didn't. It's like one of those consent agreements that companies sign with the SEC. He neither admitted guilt nor asserted innocence. So, the case ended, and we're getting ready to transfer this man onto the hospital. Now we didn't put him on a cart. We actually put him into his hospital bed where they're going to put, where he's going to go up to the floor. Which, we only did that for certain orthopedic cases. Normally, we just put people on a cart and take them down to the recovery room. So, in transferring this man, it seems that he got dry. Now, his fall was broken. It wasn't like a straight drop from the, sort of 3.5 foot high operating table down to the floor. Like plop. That big thunk like a head would make on a wooden board, like that. It was sort of delayed. It was cushioned somewhat. So they picked him up, and all the way up from the floor to the bed, he kept saying, this poor guy, he kept saying, "Oh, don't drop me again, don't drop me again, don't drop me again, please don't drop me again, don't drop me again." Well, he finally made it into the bed safely, with basically no additional harm done, and off he went. And so the next day, I eagerly awaited. There was one of these orthopedic residents was one the complete asshole, and so I asked him the next day. I said, What kind of smoke did you blow up the family's ass on this one?" And he said, he says, "We told them we wanted to be sure there wasn't a fracture on the other side, so we opened that to check, and there wasn't one. And they bought it." you you know, on one level you've got to admire that sheer ballsiness, don't you? Well, that's a completely different story than what I intended to tell you, so I'm gonna end it here on that one. Bye bye, YouTubers.